What is anterior, intermediate, and posterior uveitis? Imagine your eye as a complex, delicate machine with many layers working together. Sometimes, parts of the system can become inflamed, leading to a condition called uveitis. Uveitis is inflammation of the uvea, which is the middle layer of the eye. This layer includes the iris, ciliary body, and choroid. The type of uveitis depends on which part of the uvea is affected, and understanding these differences helps doctors diagnose and treat the condition effectively. Let's start with anterior uveitis. This is the most common form and involves inflammation of the iris, the colored part of your that controls how much light enters. Because it affects the front of the eye, symptoms are often quite noticeable. People might experience redness, eye pain, sensitivity to light, and blurred vision. Anterior uveitis usually affects one eye but can sometimes involve both. It tends to be less severe than other types but still requires prompt treatment to prevent complications. Next is intermediate uveitis, which involves inflammation mainly of the ciliary body and the vitreous, the gel-like substance filling the eye behind the lens. This form is sometimes called pars planitis when the inflammation centers on a specific part of the ciliary body called the pars plana. Symptoms often include floaters, which are small dark spots or squiggly lines drifting across your vision, and blurred vision. Pain is less common or mild in this type. Intermediate uveitis often affects young adults and can be linked to autoimmune conditions like multiple sclerosis or sarcoidosis. It tends to be a chronic condition that may relapse over time, but it usually causes less sudden pain than anterior uveitis. Finally, posterior uveitis affects the back part of the eye, involving the choroid and retina. This is the least common form but can be the most serious because it has the potential to cause significant vision loss. Symptoms may develop gradually and include blurred vision, floaters, and sometimes painless loss of sight. Because it affects the back of the eye, symptoms might not be obvious initially and are often discovered during an eye exam. Causes of posterior uveitis can be infectious, like toxoplasmosis or tuberculosis, or non-infectious, related to autoimmune diseases. Uveitis can affect one or both eyes and may start suddenly or develop gradually. The causes are varied, including autoimmune diseases, infections, eye injuries, or sometimes the cause remains unknown. Treatment depends on the type and cause of uveitis. Non-infectious uveitis is usually managed with anti-inflammatory medications such as corticosteroids, while infectious causes requiring specific antimicrobial treatments. Early diagnosis and proper treatment are crucial to prevent serious complications like glaucoma, cataracts, or permanent vision loss. Understanding the differences among anterior, intermediate, and posterior uveitis is essential for effective management. If you experience symptoms like redness, pain, floaters, or vision changes, it's important to see an eye care professional promptly. Regular eye exams and timely medical care can help preserve your vision and overall eye health. Always consult with a healthcare provider for personalized advice and treatment options tailored to your specific condition.